Another thing that I've had experience of and I recognise as a theme that plays out in the care system and the medical field, the psychological field, is that there's often it's not an intent. It's not an intent. It's just a lack of understanding and a lack of resource in some capacity. But essentially, neurodivergent individuals, autism, ADHD, and whilst largely it's considered a personality disorder, I will include psychopathy in this. They can be commonly assessed as having schizophrenia, psychosis, or mental health conditions because their traits of neurodivergency are being misunderstood. Certainly their capacity for different and creative thinking. Now, with my experience, to a degree, I did have some mental health problems and I did experience an amount of delusion. But given the fact that I've been off medication for a substantial amount of time and not experienced any delusion, any psychosis, anything, I think it's conclusive to say that the assessment that I have paranoid schizophrenia was incorrect. I may have experienced quite an extreme psychosis, but I'm not a schizophrenic. Now, because the assessment in the NHS in this region, Hull and East Riding, Humberside, has been chronically underfunded, the resources in neurodivergency has gone under mental health, and that isn't good because there is a distinction. But essentially, in my case and in many others' cases, is when they're being assessed for neurodivergency, the psychiatrists and psychologists and therapists that treat them and evaluate their symptoms, they're trained in mental health, not neurodivergency. And this can create a lot of misevaluation and inaccurate diagnoses. Now, what I experienced, while I experienced some psychotic symptoms at times, during my mental health sections, I was sectioned 5 times, I can conclusively say that I wasn't necessarily in a place of psychosis. And I would try and seek stimulation out of a very unstimulating environment. In Newbridges, the mental health hospital, there was nothing to do. And I have always needed high levels of stimulation. It's something that I've struggled to manage over the years. So essentially is I would creatively play personas. As I've expressed in other videos, in order to integrate a capacity for aggression, I would imagine extreme and dangerous situations, and through essentially creative role play, overcome my capacity for fear and my emotional resilience to the violent realities of the world. And I was, in Newbridges, I was heavily influenced by many sort of creative themes and personalities. I was into Charles Manson. I took an interest in the mafia. So many different, I was role modeling many different antisocial personalities and trying to incorporate those traits in myself. And I would walk through the mental health facilities, and I would engage with doctors and engage with patients in a way that I understand now was being perceived as erratic, psychotic, manic. And what I can address clearly is that again was my ability to detach from empathy and emotions. And I think this happens when a neurodivergent individual, particularly someone with complex neurodivergency, goes through a mental health evaluation. Their capacity for fantasy, their capacity for creativity, and their capacity for masking and mimicking and playing personas, it's not understood. And I think in some cases the reasons why neurodivergent individuals will play personas and mask traits of other people is because they haven't formulated a strong identity in themselves. And I think in psychopathy particularly, but also with other conditions such as autism, is the way they process emotions does not necessarily respond to the typical understanding psychologically of human behavior in response to emotion. So I would be assessed, and the psychiatrist would have obviously an academic accredited understanding of how emotions work in an individual, and they would see me, and I would be detached from that emotion and that empathy, and because of the stimulation I would be acting in creative ways, a bit like Charles Manson did in several interviews. And it was a similar situation. You know, a lot of professionals suspected that Charles Manson was schizophrenic because he didn't fit the expectations of what was normal. And I can see that the assessment of what I was going through was that I was in psychosis, or it was bipolar, or it was schizophrenia. It wasn't. It was creative role play for stimulation. And I think that's something that the public and professionals in mental health, neurodivergency, psychology, and wellness need to be aware of. And I imagine there are a lot of neurodivergent people who are stuck on medication in mental health facilities and diagnosed as schizophrenic, when really their neurodivergency is just being misunderstood. So yeah.